Welcome to the Detroit Lions Morning Rounds podcast. I'm Jimmy Liao, University of Michigan Medical School graduate. Let's talk about COVID. Ed Orgeron, the LSU head coach, says that most of his players have already contracted COVID. It wouldn't surprise me if that's true. COVID has been around for at least 6 months, if not 8 months or longer at this point. There's a decent chance that a large percentage of the American population has gotten COVID. Especially true in young, healthy, active college adults. So there's a good chance that this is true. However, how would he know this? The only way to know with some certainty is if they actually tested positive for COVID. Yes, there is a possible false positive rate, as we saw with the NFL with the highly publicized New Jersey lab that had 77 false positives because of some kind of lab contamination, lab anomaly, or lab error. But the false positive rate is considered to be very low overall amongst most medical professionals. There is another test for COVID called the COVID antibody test. That can also be used sometimes to see if you've had previous infection. However, that test is not nearly as reliable at this point to use with any amount of confidence. There are way too many possible false positive and negatives with the antibody test, and there's the lack of a gold standard test. A gold standard test is a test that is extremely accurate, extremely reliable, that we can judge any new test against. We don't have a gold standard test, so we're using all these antibody tests with the hopes that they're accurate, but we really don't know for sure. So the antibody test really is not very useful at this point to determine if somebody's had a previous infection or is immune. Now, there's a question, can players contract COVID again? Absolutely they can. The hope is, though, that there's some immunity which allows the body to clear it from their system quickly before it can cause symptoms and before it can be spread to others. Here's how you can contract it again. Somebody coughs in your face. You kiss somebody, you're very close contact with a bunch of people with COVID and you breathe it in. A nasal swab could certainly pick up COVID. It could be in your system. But if you have immunity, it clears it out quickly. Hopefully that means a positive test reverts to a negative test very quickly, and you might have just an isolated positive test. That may have been what happened with Matthew Stafford's famous positive test in the NFL, which a lot of people reported as false positive, but I don't think is a false positive. Dr. Sills, the NFL chief medical officer, also did not believe it was a false positive. He called it an unconfirmed positive, also known as an isolated positive, in my opinion. And Dr. Sills also said that he likely had COVID in the past, and one possibility of the positive test was there were just remnants of the virus particles still in his system. So this is an example of how you could have had COVID in the past, gotten immune, but a month or two later still test positive for COVID. So that's it for today. Thanks for watching and listening. Feel free to leave comments, ratings, reviews, or subscribe. Thanks.